All right, let's jump right in. When you first look at a chest x-ray, it can just seem like a mess of black, white, and gray shadows, right? But what if I told you there's a simple, step-by-step way to decode those shadows and actually read the story they're telling? Well, that's exactly what we're going to do today.
See, this isn't just a static picture. It's a full-on narrative of what's happening inside someone's body. And yeah, it can be super intimidating, kind of like trying to read a language you don't know. So the big question is, how do you even start? Don't worry, we're going to crack that code together.
So, before we can read the story, we've got to learn the language. Let's start with the absolute basics.
So, what exactly is the chest x-ray? You'll often hear it called a CXR. Think of it as a 2D snapshot of the chest. It gives us a look at the lungs, the heart, the big blood vessels, even the bones, all in one go. It's super quick, super effective, and that's why it's one of the most common go-to tools in all of medicine.
Okay, but here's a pro tip, and this is super important. You never ever just jump in and start looking for the problem. Nope. The first absolutely crucial step is always quality control. And guess what? We've got a brilliant little system for that.
I mean, think about it. Before you'd seriously critique a photograph, you'd make sure it's actually in focus, right? Well, it's the exact same idea here. We have to make sure the image is technically solid enough to even read properly. And to do that, we use a really simple, easy-to-remember mnemonic, RIP.
All right, let's break this down. R is for rotation. Is the patient nice and straight? Because if they're twisted, it can create all sorts of misleading shadows. I is for inspiration. Did they take a big enough breath? A weak breath can make the lungs look all crowded. P is for projection. Was the picture taken from the back to front or front to back? It actually changes how big the heart looks. And finally, E is for exposure. Is it too bright, too dark? If you can check off all four of these, then the image is, well, ripe for reading.
Okay, so once we know we've got a good, quality image to work with, we're ready to unlock its secrets. And for that, we have a master key. It's the ABCDE checklist. Seriously, this is how you read an X-ray like a pro, without missing a thing every single time. This system is the absolute heart of the whole process. It forces you to look at every single key area, in order, so nothing gets overlooked. It goes A for airway, B for breathing, C for circulation, D for diaphragm, and E for everything else. Simple, right? Let's walk through it.
First up, A is for airway. That's that big, dark tube of air you see running down the middle.
So what you're looking for is pretty straightforward. First is the trachea. That's your windpipe. Is it dead center? If you see it getting pushed to one side, that might mean there's a mass or some fluid pushing it. If it's getting pulled over, that could signal a collapsed lung. Right away, that's a huge clue.
All right, next up is B for breathing. Now we're looking at the lungs themselves.
Okay, so here's what you're checking. First, compare the left and right lungs. They should basically be mirror images of each other. You also want to make sure you can see those faint, wispy lung markings all the way out to the very edges of the chest. And this is a big one. Look at the very bottom corners. Those are called the costophrenic angles, and they should be nice and sharp, like a pointy V. If they look kind of rounded or blunted, that's a classic sign there might be fluid building up.
Moving on to C for circulation. And yeah, this is all about the heart and those big blood vessels. The main thing we're checking here is the size of the heart. There's a really quick and easy measurement called the cardiothoracic ratio, or CTR. Basically, you look at the width of the heart and compare it to the total width of the chest. The heart should take up less than half that space. If it's bigger than 50%, that's a sign the heart might be enlarged. You also just want to see that the edges, the borders of the heart, look nice and sharp.
All right, we're making our way down the list. Next is D for diaphragm. This is that big muscle that sits at the very bottom of your chest.
So, a cool little fact, the right side is usually a bit higher than the left. You know why? Because your liver is tucked right under it. Both sides should have a nice, smooth dome shape. But here's something you really have to look for: any black pockets of air trapped underneath the diaphragm. If you see that, it is a huge red flag. We're talking a potential surgical emergency.
And finally, we've arrived at E, which stands for everything else. Think of this as your safety net. It's the final sweep to make sure we didn't miss anything. So here, you're just systematically scanning all the bones. Check the ribs, the clavicles, the vertebrae. Are there any fractures? You'll also glance at the soft tissues on the outside. And if the patient has any hardware, pacemakers, lines, tubes, you just double-check that everything is sitting right where it should be.
Okay, theory, check. Checklist, check. Now for the fun part.
Let's actually put this all into practice and see how this system works with a real case.
So, meet our patient. He's a 25-year-old guy who's come in with a cough and a fever. The doc orders a chest x-ray. Let's see what we can find using our brand new system.
And this is where the magic of the system really shines. We just walk through our checklist. A, airway, looks central, all good. C, circulation, heart size is normal. E, everything else, bones look intact. But wait, look at B and D. For breathing, there's this white, cloudy area, an opacity, down in the right lung that just isn't there on the left. And remember that sharp corner we looked for under D for diaphragm? On the right side, it's totally gone. It's blurred out by that same shadow. See? The system led us straight to the abnormality.
So, just by following our steps, we can come to a really solid conclusion. That cloudy spot in the right lower lung, plus that blurred out angle, all the signs are pointing directly to a classic case of pneumonia.
Now, finding the problem is half the battle. Communicating it clearly and professionally is the other half. So the final step is to take what we found and put it into a proper report.
And just look at the difference here. A normal report is pretty straightforward, right? Lungs are clear. But for our patient, the report takes our findings and uses that precise language. That white shadow we saw, that's a patchy opacity. That blurred corner, that's the right costophrenic angle obscured. It all comes together to support that final, confident diagnosis. That is the power of the system from start to finish.
So when you boil it all down, the secret to reading a chest x-ray isn't some kind of magical skill. It's not about having superhuman eyes. It's just about having a system. A simple checklist that takes you from what looks like chaos to perfect clarity. And you know, that idea of breaking down a huge, complex problem into small, manageable steps, that works for pretty much anything, not just medicine. So it kind of makes you think, right? What's a complex problem in your life that you could totally solve with a simple checklist?